主啊，我们来到你的面前，献上感恩，感谢主，你每一天赐给我们有足够的恩典，也让我们得着你的力量。主啊，就求你的圣灵在这一刻安静我们的心，也洁净整个会场，也让整个网络顺通。主啊，求你与我们同在。我们这样简单不完成祷告，是奉主耶稣的圣名求 ，Amen。好，姐妹们，谢谢。我们今天又来到我们主爱的聚会，我们先听一首诗歌，安静我们的心。
没有狂风暴雨的洗礼，蓝天怎会呈现一片清澈？没有世间人情的冷暖，生命岂能绽放一句缤纷？苦难原是一份化妆的祝福，引导我们一步一步成圣。没有狂风暴雨的洗礼，蓝天怎会呈现一片清澈？没有世间人情的冷暖，生命岂能绽放一句缤纷？苦难原是一份化妆的祝福，引导我们一步一步成圣。主耶稣，主耶稣，你是我救主，是我良朋。你的恩典够温柔，随经患难我永不迷
是的，主啊，你的恩惠紧紧的跟随着我们，你的话语成为我们脚前的灯，路上的光。啊，你的杖、你的竿都安慰着我们，与我们同行。虽然我们经过死荫的幽谷，因为有一个慈爱的天父拖着我们的手，所以我们在患难当中也得着真正的从天而来的平安。感谢主，你的拣选让我们今生成为你的儿女。好，我们再放一首诗歌。
God will make a way, take one. And God will make a way where there seems to be no way. He works in ways we cannot see. He will make a way for me. He will be my guide. Hold me closely to his side. With love and strength for each new day, he will make a way. He will make a way. Oh, God will make a way where there seems to be no way. He works in ways we cannot see. He will make a way for me. He will be my guide. Hold me closely to his side. With love and strength for each new day, he will make a way. He will make a way. By a roadway in the wilderness, he'll lead me. Rivers in the desert will I see. Heaven and earth will fade, but his word will still remain. That's right. And he will do something new today. Oh, God will make a way, yes, he will, where there seems to be no way. He works in ways we cannot see. He will make a way for me. He will be my guide. Hold me closely to his side. With love and strength for each new day, he will make a way. He will make a way. With love and strength. With love and strength for each new day, he will make a way. He will make a way. Yes, he will. He will make a way for you.
是的，神会 make a way for us。神会带领我们每一天每一天的生活，也带领我们的一生。主啊，感谢你，求圣灵在这一刻与我们同在，也洁净整个会场。 也让整个网络畅通。感谢主赐给我们有爱心的黄医生来到我们当中，以我们可以和姐妹们回答他们想问的问题。主要就求你祝福黄医生和他的家人，与他们同在。感谢赞美主，我们这样祷告，是奉主耶稣的圣名求 ，Amen。哎，黄医生，很久不见，谢谢你参与我们今天的聚会。姐妹们，我们今天很荣幸请到黄医生来到我们中间。他是有几十年肿瘤他是有几十年工作经验的肿瘤科医生，所以很感恩他可以在他百忙当中来到我们当中回答姐妹们所问的问题。今天黄医生会尽量的回答大家的问题，但是如果今天没有办法说完的时候希望下一次黄医生有机会的有时间的时候再回来啊、再回来回答大家所剩余的问题。有一个就是大家所提的问题黄医生所回答的，你们最好还是因为你们每个人的身体状况，还有自己的身体的详细情况，黄医生未必知道，所以最好还是要和你们的自己的肿瘤科医生最后寻求你们需要回答或者需要治疗的方案。好，我现在我们有一些问题，就是之前收到姐妹们所问的问题，那我们就first come first serve，就是从第一条我们收到的问题，从第一条开始黄医生尽量的回答，但是可能今天大概有30分钟。或者是最多45分钟给黄医生，因为他也是很忙的。如果今天做不完的话，那下一次他可以再来。好，Thank you, Dr. Huang. Thank you to joining us again. So what we're going to do is we're going to start with
我
the
都听懂了，都
你
听懂了。
听懂了？OK，好的，
Yeah.
太好了。如果你有可能用中文回答
哦，那就大概不会了。Yeah，我的中
，OK，
文不是最好的，可以
那好，
听懂，就是讲不出来，特
讲不出来。
别是医
好的。
学的东西。
好，那我
So
先把问题打开。
okay, so first I wanted to agree with everything you said about, they need to ask their oncologist about these things because I don't know the details of their case. And every case is so dependent, like every pathology report and every, unless I don't have everybody's full medical history. So because I don't have that, I could easily be giving you the incorrect advice. So if you hear something different than what your oncologist has told you in the past, just ask them about it. But, you should not take my advice for, the truth, okay? Because I don't have all the information.
是的，好，那我们就从第一题开始。
Okay, yeah. So the other question I had is, you mentioned that there were several urgent cases. Do you want me to do the urgent cases or do you want to just start with number one?
I think we can just start from the number one.
Okay,
And then when do you think next week you have some time or no?
下个礼拜四, probably. Yeah, 可以. Yeah, I can.
Yeah. So
yeah.
if 如果下个星期四你可以来的话，那可能我们今天就可以把现在收到的问题先回答。
Okay, 还有一个就是你要我快一点回答吗？还是你要我慢一点回答 right? So there are 18 questions and we have 30 minutes. And, even if we include the 30 minutes next week, that's still only 3 minutes a question, even if we go fast. Okay. If you want to go slow, then I could answer the question. You could ask me further questions, and then I could answer the follow-up questions. Or should we just like 3 minutes a question and try to go as quickly as possible?
Go
And
as
does everybody see the questions, or would you like me to read the questions out?
我用中文讲吧，
好，
你就用
好，
英文答。
好，Go
第
ahead.
一条问题就是，一般现在需要检测的肿瘤标记指数包括125，还有15.3 CA 15.3 CEA，这些是不是现在可以每年包裹进去在年检里？还有没有其他的指标可以包裹在检查里面？
Okay, so first of all, the CA125 is a ovary cancer marker. So that's not a breast cancer marker. The second thing is the carcinoembryonic antigen, the CEA, is a colon cancer marker. It sometimes can go up in breast cancer, but it's not really a classic breast cancer marker as well. There is another marker that you've not included called the CA2729. Okay. So the classic breast cancer markers are the CA15-3 and the CA2729. Okay. Now, go ahead.
所以 CA 2729反而现在是可以用来做这个乳癌 breast cancer 的指标检查里面，是不是？
So the issue is that these tests have a lot of false positives and false negatives. In fact, we did studies showing that drawing these tests on a regular basis do not prolong life, and in fact, they worsen the quality of life because so many things can make these tests become abnormal, which will lead to more tests. So it's now not recommended to draw these tests on a regular basis. Now, your oncologist may draw them as part of their habit, but the national recommendations are not to draw these as part of regular breast cancer follow-up.
那如果要检查，比如说大家最大的问题就是说怎么知道有没有自己复发？除了有 symptom， 但是 symptom 有的时候可能已经有点累了有点晚了。那之前是不是每年有一些可以做的东西呢？检查的东西呢？
So it is important to do a monthly breast self-examination. Okay, it is important to do regular mammograms, once a year or twice a year mammograms. It is important to get a doctor's breast examination every 3 to 6 months. Okay, and these have all been shown to be helpful. Okay, it's also been shown to be helpful that, of course, if you are having symptoms of breast cancer recurrence, that you talk to your doctor about them so that they can be looked into. So it's important to know the symptoms of breast cancer recurrence. So, of course, breast cancer lump. Breast cancer spreads easily to the bones as well. So if you're having unusual bone pain, it can spread to the liver. So if you are having pain in your right side near the liver, then that can be something. If you're losing weight for no explanation, if you're having a cough and shortness of breath, because it can also go to the lungs. So these are the things that have been proven, and these are part of the recommended regular checkups for breast cancer follow-up.
Okay. 好，we can go for the second one. 就是现在就是这个 question 是我问的，就是如果比如说大家都完成了所有的治疗，药也吃完了，那还有什么需要的呢？需要检查或者怎么确保没有复发或者其他的事情可以做呢？除了健康饮食生活。那
Okay.
检查可以做些什么呢？
Okay, so first of all, breast cancer is all not, every breast cancer is different. So if you have breast cancer that's estrogen or progesterone receptor positive, it can recur later. So you're right, you do need to follow those people for, longer than just 5 years. So maybe 10 years, 15. If it's a dangerous breast cancer, then maybe up to 20 years. If it's a estrogen receptor negative, progesterone receptor negative breast cancer, then those tend to recur early. And so, stopping at 5 years is very reasonable for those people. There are no studies showing that taking medicines longer than 10 years makes any difference. Okay, they may be looking at a study whether going longer than 10 years will make a difference, but right now they're studying whether the difference between 7 and 10 years makes a difference. So there's no studies showing that taking medicine more than 10 years is helpful. So beyond 10 years, you want to make sure you get regular mammograms. You want to do a breast self-examination. You need to do a doctor's breast examination every year. If you took chemotherapy, maybe you should get a blood test every year to make sure the chemotherapy is not causing any problems. I think that those are the main things.
So 现在那7年用药和还有10年的比较，现在有没有 further 有更多的 data 出来 support the difference 呢？
Well, first of all, if you have a low risk breast cancer, 5 years is reasonable. Okay. Especially, these medicines have a lot of side effects. And so if people are having side effects and they have low risk breast cancer, I'm very comfortable stopping hormonal therapies at 5 years. If you're not having side effects and you want to take it longer to prevent, then I think taking it up to 10 years, especially if you have higher risk breast cancer, lymph nodes involved or, a large breast cancer. Okay, but there's no data yet as to, so 7 to 10 years beats 5 years. That's all we know so far.
OK， 好。第3个就是我是3期乳癌breast cancer 左边全切淋巴清手，完成了化疗、放疗，吃 AI 药6年半。现在由于是7年还是10年，就是刚才我们问的问题了。吃10年在预防乳癌复发有多少的获益？如果导致骨质疏松的问题，怎么取舍？怎么 how to pick 10 or 7?
Okay, so the problem is that so stage 3 breast cancer sounds like it's a more dangerous breast cancer. Okay. It also depends on how bad her osteoporosis is. Okay. So if she has bad osteoporosis and, she's very imminent to have a bone fracture, then I would be okay stopping at 7 years. If she is more worried about breast cancer recurrence than fracture, then I would be comfortable, and it's not too many side effects, I would be very comfortable going to 10 years. So there's no definite answer here. This is a very, there's a lot of details in this question and also how the patient feels.
Yeah. Okay. 第4条就是
I mean, this is why a AI will not take over an oncologist's job, okay? Because you have to ask these questions and talk to the patient and get to know what they want.
Yeah.
抱歉 ，Julie， 我说一下，就是有姐妹建议说，如果黄医生看得见问题的话，就不用读问题了，可以节省一点时间。
好的。
可是你们都看得到吗？
Yeah， 我们都看得到。
Okay, 好 ，Great. Okay.
OK， 好的。那第4条。
Okay. It sounds like this person got osteoporosis from taking their endocrine therapy. And they've been on Prolia and then continuing with the Bandronate. Okay. So there are a few issues. Okay, one is that when we gave drugs like Prolia for longer than 3 years, it did make their bone densities better, but it actually caused them to have more brittle bones. So the bone density did not actually, so their risk of fracture did not improve. So usually people stop at 3 years of these medicines. Okay. You know, and as to and don't forget that you know, women that have are postmenopausal are going to continue to lose bone density. You know, usually what will happen is we'll give them medicines like Prolia or Abandronate. We'll do it for 3 years, and then we stop for some time, and then we restart for some time. You know, this is something that usually I will leave to the internal medicine doctors or the endocrinologists to decide. But you know, I think that it seems like you've had enough for right now. I probably, you know, I think you could stop. Okay. And it's unrelated to the, you know, how long, you know, whether stopping your endocrine aromatase inhibitor. Okay, so now going on to question 5. Okay, congratulations, that's wonderful. It's so amazing. These new targeted therapies and chemotherapies are so effective. The HER2 measurement of 60%, I'm not sure what that means. That's not a measure. That's not something I'm familiar with. Usually, you know, we talk about HER2 1, 2, 3 plus, 0 plus. It's not a, we don't usually measure it in percentage, at least in the United States. So anyway, but it sounds like she was HER2 positive, so I assume that's the targeted therapy she was talking about. And you know, she's estrogen, progesterone receptor positive. So you know, it looks like you're positive for everything. And so why wouldn't you want to take all the therapy possible? If you can have more weapons to fight your breast cancer and reduce your risk of breast cancer recurrence, why wouldn't you want to take a pill to reduce your risk? So I would definitely recommend taking hormonal therapy. In addition, hormonal therapy prevents future breast cancers, can prevent lowers your risk of future breast cancers, both in the same breast and the opposite breast. So there's many reasons why taking some endocrine therapy is very helpful. But you know, since you're in a pathologic complete remission, you know, maybe 5 years would be enough of the hormonal therapy. See, this is a situation where you could have been like stage 3 to begin with, and now you're in a complete remission, and this has now become a low-risk disease because you were treated to a complete remission. So that's wonderful. So you see, it's all these details matter in the recommendations. Okay, so now I'm going on to question 6. Okay, so it sounds like you just started taking the anastrozole and Zometa because you give a date of April 2025. So I assume you just started the Zometa. So Zometa, the first dose causes a lot of side effects, okay? Well, it has a high risk of side effects, just like you had, like fevers and joint aches. I tell all my patients that the first dose often causes the side effects, and the second dose is usually much easier. And so if they really have a lot of problems with the second or third dose, then we talk about not giving it. But if they, you know, I tell them try the second time because it's usually much easier. So she mentions, is it necessary to pay such a high price? So Zometa usually is not an expensive medicine. It comes generic now. So I assume she's talking about price in terms of quality of life. So, I would encourage her to try a second try of the Zometa. The reason why Zometa is helpful is not only does it reduce your risk of osteoporosis, okay, which is a problem, but it's also been shown to reduce your risk of breast cancer recurrence. So again, why wouldn't you want to take a medicine that can reduce your risk of cancer recurrence? So I really do try to get, and it sounds like, you had a higher risk cancer because you took chemotherapy as well. So, I would take the Zometa if you try a second time at least. Okay, so going on to the next question, number 7. So it sounds like you had carcinoma in situ, okay, for a year. So I don't know what it means by the pathologic report indicates carcinoma in situ for at least a year, because that would mean you had 2 biopsies a year apart and both of them had carcinoma in situ. That means you know that it was there for a year. Anyway, so I assume you had carcinoma in situ. The details that I don't know about are that there are several different kinds of carcinoma in situ. Ductal carcinoma in situ and lobular carcinoma in situ, and they're treated very differently. So you had a full mastectomy. I will guess you had ductal carcinoma in situ. So the examinations needed, what I mentioned before. So first of all, carcinoma in situ usually does not spread outside of the breast. So you don't need to worry about bone pain and cough and shortness of breath and liver pain. And so you really just need to keep up with your breast exam. So you want to do breast self-examinations every month. You want to do a doctor's breast examination at least twice a year, and a mammogram of the other side at least once a year. Okay, question 8. Okay, so
这个是很长的。
yeah, so this medicine, hydroxychloroquine, is not really a breast cancer medicine. It really has not been shown or tested to lower the risk of cancer. Okay, so I can't, maybe it helps, but maybe aspirin helps, right? So I just also want to encourage everybody that, in addition to breast exams and being attentive to symptoms, it's very important to keep your weight down, okay, with breast cancer. And it's also important to exercise regularly. These things have been shown to reduce your breast cancer risk. There are some studies that show regular exercise can reduce your recurrence risk in half, which is amazing. That's as much as you get from hormone therapy or chemotherapy. So it's very important to do regular exercise and keep your weight under control. Avoid alcohol, try to eat a low-fat diet. These things can be very helpful. Okay. So unless your endocrinologist has recommended hydroxychloroquine, I probably would not take a prescription medicine just for breast cancer. Okay. Not this one. Okay, question 9. So how to determine if hormonal therapy is sufficient with 5 years intake? So many of you are in the situation that you're breast cancer survivors and you're worried about a recurrence, okay? So I tell my patients that breast cancer, cancer recurrence is kind of like treating weeds, okay? So you had a beautiful lawn and then a weed shows up on your lawn and that weed is the cancer, okay? The surgeon will surgically remove the weed, okay, and then your lawn looks beautiful again. And then the question I often get is, why do I need to take radiation? Why do I need to take chemotherapy? Why do I need to take hormone therapy? The weed is gone and my lawn looks beautiful. So why do I need to do these therapies? Okay. And so I tell them the problem is that there's a chance that there's a weed seed somewhere on your lawn. Maybe 1, maybe 10, maybe 0. We have no idea, if there's a weed seed. These are too small to see. No scan can find them. No blood test can find them, because all you need is one cancer cell that's still there that was not killed by all the therapy, and it grows back and the cancer will come back. Okay. So the problem is that there is no test that can tell me whether we got all the cancer cells. Okay. So I can't tell you that you've gotten enough chemotherapy. I can't tell you if you've had enough hormone therapy. The only way to know is the test of time. Okay. And if 5 years, 10 years have gone by and the cancer has not come back, it is very, very unlikely to come back. And it's probably cured. Okay. So, but the more therapy you get, the less chance of weeds coming back. Right. So I tell people that radiation is like a treatment to the local area. Okay. The highest risk for weed seeds is very close to the original weed. So the radiation treats that local area to try to kill off that high risk area for weed seeds. And then I tell people that chemotherapy is like a chemical weed killer that you put all over the lawn. Okay. And it can hurt your lawn. You have to be careful about how much you put on. But it can be very effective. And then I tell people that a hormone therapy is like a natural weed killer, okay, an organic weed killer. So you just put a little bit of organic weed killer on the lawn, and it's very, very effective. Okay, but if you have a dangerous cancer, a weed with, let's say, several dandelion balls, that's the lymph nodes, because that's how the cancer spreads to other places. So if you have a dangerous cancer, then you need more therapies. Okay, because the more therapies you can give, the less chances for weeds to come back. And I think that's a very good way of thinking about, cancer therapy. Okay.
Sorry, doctor.
Yeah.
I think this is the question I ask. So my situation is I'm in low risk, grade 1, no chemo, just have some tamoxifen for 5 years. So my doctor suggests me to stop after 5 years, which is this year. And she strongly recommend me to stop, but I know there is a task. I don't remember what is the test name. In US can actually give you the reference about how many years you need to take the hormone therapy. So that's why I asked this question. Yeah.
Well, I would agree with your oncologist that 5 years is probably sufficient for you because you had a low risk disease. Okay. They are doing other tests, but these like such as circulating tumor DNA, is that what you're talking about?
I think so, yeah.
Okay, so the problem with circulating tumor DNA is it's not a proven therapy. Okay.
Oh, okay.
So if you have a positive, you don't know if it's a false positive or a true positive. Okay. If you have a negative, you don't know, these tests have false positives and negatives. So they take time for us to do the research to see if it's worthwhile to do it.
Okay.
Okay. So, I would not worry about it. I would, you had low risk disease. The other amazing thing about breast cancer, I know that, it's very worrisome and you guys are very worried about it and you're doing, but I also want to reassure you that the therapies for breast cancer are so good now, really amazing. I've been an oncologist now for 30 years and I have seen so many breakthroughs, and really even the highest risk breast cancers, the cure rates are 70–80%. So, it's really amazing now how good what the breast cancer treatments are. And I know that, a cure rate of 90% or 80% is good, but I know for you guys, you probably feel, oh, that's still too high a risk. I know, but I'm just also trying to reassure you that most likely everything is going to be fine.
Okay. Thank you,
No matter
Doctor.
what you do, everything is probably going to be fine. Okay.
Thank you.
Yeah. Okay. Question 10. Okay. The aromatase inhibitors should only be given to postmenopausal women. They only work in postmenopausal women. So if you give it to a premenopausal woman, then it will not work, and you're not getting any hormonal therapy. Okay, so that's why in premenopausal women we have to use tamoxifen. Okay, in postmenopausal women we can use tamoxifen or an aromatase inhibitor. Okay, so the question is, how do you define postmenopausal? Okay, so in the studies they define postmenopausal as 2 years without a period. Okay. Now, you mentioned having a period in January of last year, so it's not quite 2 years left. And so usually in that situation, we will draw the tests you've recommended. You've written down the FSH and the estradiol levels. And if they show that you're postmenopausal, it's reasonable. I would probably give you an aromatase inhibitor. Okay. Now, there are some caveats to that. Like if you are young and you took chemotherapy and your period stopped because of the chemotherapy, we've had ladies who had their periods come back despite having a normal FSH and E2. And then it's scary because, they were not being treated because they were just on an aromatase inhibitor. And so, I will get regular every 6 months FSH and estradiol to make sure that their levels remain low. Okay, question 11. High grade in situ ductal carcinoma. Okay. All right. So both are reasonable. A partial resection to negative margins plus radiation is equivalent to a total mastectomy. Okay, a total mastectomy does not require radiation. So really the decision is, whether you would like to have an easy surgery followed by radiation, or would you rather have your whole breast removed and not need radiation? Okay. These days, generally, we advise the partial resection to negative margins plus radiation because radiation has gotten so advanced, it's gotten shorter and shorter with fewer and fewer side effects and fewer risks. And then you get to keep your breast and you get to look more natural, right? If you remove your breast, then you can have a surgery to reconstruct things, but it's just more surgery, more risk for post-operative pain. It never looks as good. It's very hard to make it look as good as a partial resection plus radiation. Okay, so really, generally, we recommend the partial resection plus radiation, unless for some reason you want to get your breast removed, and you don't want to get radiation for some reason. Okay. Okay, next, how to determine bone metastases? Is it necessary to take CDK4/6 inhibitors for more than 2 years? Okay, so I'm not sure what these questions mean. So I'm going to guess that it means that you have bone pain or you have abnormal blood tests. And so you're worried about bone metastases, and what can your oncologist do to see if you have a bone metastasis? So they could order a bone scan, which is a nuclear medicine scan, or they could order a PET scan, which is also a nuclear medicine scan. They could also, even if those are positive, sometimes there are false positives. And so sometimes you might need a biopsy too to make sure that you have a bone metastasis. Often these days we will recommend another biopsy because, maybe things have changed. Sometimes maybe you are estrogen receptor positive and you've lost your estrogen receptor positivity. And so, we do usually recommend another bone biopsy to confirm and then also to make sure that its nature has not changed. Okay. CDK4/6 inhibitors for more than 2 years. Okay, so CDK4/6 inhibitors are usually added to hormonal therapy for either people that have advanced breast cancer, or in other words, breast cancer that's already spread to their organs and bones, or it's given for very high risk estrogen receptor positive breast cancers. Okay. So if it's being given for, advanced stage 4 breast cancer, then we just continue giving it. We don't stop it. Now, of course, if you can't afford these medicines, you don't need to take it. The main part of hormonal therapy is the hormonal therapy, not the CDK4/6 inhibitor. CDK4/6 inhibitors can be very expensive. And, if it's financially burdensome, then you don't need to take these medicines. So when I give these answers, also, I'm assuming that no money issues are involved. Okay. So anyway, now let's say the other situation, you have a dangerous, like many lymph nodes involved, dangerous there's about 5 or 6 different ways to measure whether you are dangerous enough to warrant a CDK4/6 inhibitor, in addition to hormonal therapy. If your breast cancer is dangerous enough, then we will often add the CDK4/6 inhibitor for 3 years. Okay. Now, I will have ladies that really don't like taking CDK4/6 inhibitors, either because of the side effects or because of the expense, in which case we could stop it early. It's, but the study was done for 3 years. Okay, question 13. Hey, I think at this pace we could finish everything. I can keep going, okay? I know we're past time.
Yeah, is that okay? We can finish this.
Yeah, let's try to finish.
One question. I think I haven't added the additional question, but next week when you came, we can. They are still sending question even as of today. So there's some new questions. So we can answer that next week.
Well, if I thought I could save myself another trip from coming back, I would finish today. I mean, if we're gonna do another trip next week, then why don't we just stop here and then save it for next time?
Okay, sure. Yeah. 姐妹们，我们可以，大家如果有需要有问题的话，你们可以留下来，我们尽量的回答刚才黄医生回答给大家的答案，我们可以讨论一下。那下个星期黄医生会再一次的来到我们当中，如果你们有什么问题，可以在我们的 chat 里面再问。我们把问题再交给黄医生，下个星期他可以再来回答一些的问题，好不好？
黄医生可以再回答一个问题吗？就是我们有一个姐妹，她的治疗非常紧急。小Angela 你在吗？你可以把你的问题问黄医生吗？
还有丽，你也可以问一下。如果丽你想问黄医生，也可以问黄医生。等一下。
黄医生你好，我是 Angela 44岁。I was diagnosed in June this year with stage 4 triple negative breast cancer with had already spread to the liver, lungs, and the bones. I start weekly treatment on July 9 using Keytruda and Abraxane. So
and what?
Abraxane.
And Abraxane.
So after 5 weeks, the primary tumor in the left side breast hasn't softened or smaller, but the swelling and pain in the lymph nodes have significantly improved, and there is stabilizing sensation in the liver lesions. So my question.
Wait. Say that last sentence again. 我没听懂。
Liver lesion.
Liver lesion.
缩小了吗？还是没有变化？
Stepping sensation.
他的问题在 first question in the chat on the chat.
Yeah,
First
she
question
English.
in the chat.
That was English. Yeah.
Oh, I'm sorry. I have not been reading the chats. Okay, I've been so focused on everything
Thank you,
else.
Dr. Huang.
Okay.
Yeah, the first question in the chat. Yeah.
Okay. So are you doing okay with this? Are you having a lot of side effects?
I have no side effects at all.
Okay, great. Then it's reasonable to add carboplatin. It's reasonable.
But the question is, do you recommend to adding carboplatin at this
Well,
moment?
I'm just saying it is reasonable.
Sorry, you mean it's reasonable to add the carboplatin now, right?
Yeah, it's reasonable. Yes, especially because you're not having side effects.
But is there any data shows that the effect of Abraxane together with carboplatin is better than Abraxane only?
Okay, so the first thing to remember is that our goal is a long and good quality of life, okay?
Right.
And so the best thing would be if we can get you to a point that you're on Keytruda only and no chemotherapy. Okay, so in some ways, it doesn't really matter how much chemotherapy you get now. What matters is, whether the Keytruda works and whether that is going to work for the long term. Okay, so it's all good news that this is all working. I would probably consider adding the carboplatin in, especially if you are BRCA positive or something like that. The adding carboplatin, the reason I'm hesitating is, it's when a person has stage 4 breast cancer, it's a balance between quality of life, right?
You are right.
Okay, and more shrinkage, okay? Because just because we shrink it down doesn't necessarily mean that we're going to give you more time. That's what I'm saying. Okay, so if you are having an easy time of it and you want to be more aggressive, then adding carboplatin is reasonable. Okay, but that's not, doing the hardest therapy does not mean the best outcomes. I have a story about, I had this Russian patient. Okay, she had lung cancer, not breast cancer. And she went back to Russia for a second opinion, and she came back with this most barbaric chemotherapy regimen. This was something we gave like 20 years ago. Okay, such horrible chemotherapy drugs, like 3 or 4 chemotherapy drugs. And I told her, why do you want to take this? She was very adamant about getting these medicines. She said she saw the top oncologist in Russia, and I said, we've advanced so much more over this. And she said that, in Russia, we believe you must suffer to gain. Like you have to suffer in order to improve yourself. And so anyway, she changed oncologists because I refused to give her those medicines. It's really, a lot of people in your situation want to do as much as possible. Okay. And I think that it's a reasonable thought, but I also want to, also you need to think about, making sure that you're able to enjoy your summer vacation. Okay, what's remaining of your summer vacation. And if you really do want to be aggressive, then maybe consider going on a trial, when this is done. Or, because that's going to get you, if there's something magic, that's the most likely to give you something magic.
Okay, I understand.
Okay.
Thank you.
And don't forget to take a bone Zometa, with your chemotherapy.
Actually, my PD-L1 is negative, and BRCA1 and BRCA2 are also negative. So I don't think I have too much choice.
Yeah, so your adding the carboplatin is going to add a little bit, but not a lot more. So that's why,
Understand? Yeah.
Yeah.
my medical my MO currently also have the same opinion with yours. So that's why she doesn't yet add the carbo for me. And she said if the abraxane only doesn't work, she will change to use the Trodelvy.
Yeah, there's all these new fancy medicines, so it's great.
Thank you very much.
Sure.
好的，那 Jane 你就问最后一个问题好不好？
Okay, yeah, I just asked the last question. I have PRER positive and HER2 negative stage 4 breast cancer found last year, and my bone is already has the tumor found. So last month I found there is fracture on my T8 on my spine. So my question is, I already taken Kisqali and letrozole over a year, plus Xgeva.
I'm sorry. Could you repeat the last sentences again?
Yeah. So I'm taking letrozole and Kisqali over a
And
year.
Kisqali. Okay,
Yeah.
go ahead.
Yeah. Plus, I'm taking Xgeva injection once every 3 months.
Okay.
I still found new tumor on my spine. So my question is, does it mean that this medication does not work anymore? And I need to take some advanced treatments, and besides a radiation and some other treatments, is there any better therapies available for the bone lesion?
Okay, there's a couple of issues here. Okay, so one is that we give our best treatments first. Okay, we give our second best treatment second, third best treatments third, and you would want us to do it that way, right? Why would you want us to save a better treatment for later? Okay, so letrozole plus Kisqali for stage 4 breast cancer is the best treatment. Okay, and you want to be on that treatment for as long as possible. Okay, because how long you live for is based on how long we have more therapies for you, right? How long we can go for. And so I tell people this is like a box of matches. Okay, and let's say we've got 6 or 7 matches left, right? You don't want to throw away the current match until it's definitely not working, because once we throw it away, it's gone. Okay, so
Okay.
you don't want to stop this unless we're sure that the cancer is progressive.
Okay.
Okay, so that means bone scan getting worse or PET scan getting worse. If you're sure it's progressive, then you need to change to something else, and you may want to consider going on a trial. This is the time that you might want to get next generation sequencing done to talk about next steps, because there's all these new therapies that are coming for next steps, but you need to have next generation sequencing done.
Okay. So currently just to keep current therapy.
Well, because I don't know the data that you have, right? I don't know all the details of what your exact situation is, but if your cancer is not clear whether it's progressive or not, you should stay on this. If you're clear that the therapy is definitely not working and the cancer is growing, then change to something else. And the change would depend on your next generation sequencing.
Okay. Okay, all right then.
And maybe consider going on a trial, okay? Because we want to help other women in the future. And if your back pain is getting worse, maybe consider radiation, okay? Radiation is it's an excellent therapy. It's terrific for back pain and can prevent, being paralyzed from that spot in your T8 growing into the nerve.
Oh, okay. So for the bone tumors, that is the best way therapy, the radiation?
I'm sorry, I couldn't hear you. Say that again.
Okay, for the bone lesions or tumors, radiation is the best therapy?
No, radiation and chemotherapy do different things, and hormone therapy do different things. Okay, so remember, like my story about the weed. Okay, so radiation is very, very good at treating one fixed area where they aim the beam. Okay, so if you have a bone spot at T8 that's getting close to touching the nerve and causing you to be paralyzed, then radiation is the best therapy. It's the most effective therapy because it's going to, kill the cancer in that one spot. Okay, the problem with radiation is it doesn't treat the rest of the lawn. Right? If you have one area that's growing, you probably have more areas that are growing. So, if you have a T8 spot that's growing, then you would probably need, radiation if it is getting close to the nerve and a change in your hormone therapy.
Okay.
So it's not one or the other. It's one and or the other.
Oh, I see.
Okay. So it's not like one is better. They're different tools, right? Sometimes you use a hammer. Sometimes you use a screwdriver.
Uh-huh. Okay. Yeah. Thank you.
Sure.
Okay, thank you, Dr. Huang. Thank you so much.
All right, no problem. Bye.
Okay, see you next
好，
Thursday.
再见。
好的，行，谢谢。
Me too.